Health and illness in modern healthcare. All healthcare providers are socialized into the social and cultural system of their profession. As pre-professionals, students are socialized about their respective profession's beliefs, practices, habits, likes, dislikes, norms, and rituals. Western socialization of professionals. Each discipline has its own language, objects, rituals, garments, and myths, which become a part of the scope of the student's education, socialization, and practice. As students become more immersed and knowledgeable in the scientific and technological domains, they move further away from their ethnocultural beliefs and practices of health and illness. The beliefs: standardized scientific definitions of health and illness, subscription to the Cartesian philosophy that the mind is separate from the body, omnipotence of costly technology, frequent execution of costly tests and procedures. Western medicine likes promptness, neatness and organization, compliance. Tardiness is not liked, neither are disorderliness and disorganization and questioning of authority. Custom and rituals, professional deference and adherence to the pecking order, and the unwritten rule that the doctor is God. Hand washing, the use of certain procedures attending birth and death, and expectations, the expectations of recovery no matter the cost or consequences of therapy. Healthcare cost. The United States has the most expensive healthcare delivery system in the world, and the costs of healthcare continue to soar. In 1940, about $4 billion, 1960, 27.5 billion, 2008, 2.3 trillion, and 2018, 3.6 trillion and rising. Healthcare continues to grow faster than the economy and is a large portion of our gross domestic product. In 1968, it made up about 6.2% of GDP, and by 2018, it made up 17.7% of GDP. Rising healthcare costs are primarily due to advances in and use of medical technology, the cost of pharmaceutical products, rising costs of health insurance. Health insurance companies often disallow many needed procedures or stop payments after a certain amount is reached. Catastrophic healthcare costs is a major reason for filing for bankruptcy. The 2010 Affordable Health Care Act aimed to reduce premium costs for millions of families and small business owners who are priced out of coverage today. It also aimed to provide health care coverage for the more than 32 million or so people who have no health care coverage. And there are always ongoing legal challenges. Barriers to healthcare. In addition to being expensive, the US healthcare system has been criticized for being inefficient and not being user friendly. Patients often do not know what to expect from the host of professionals who poke, prod, draw blood, and shine lights into body parts with or without introducing themselves to patients. Patients are often confused as to where to go, how to get there, what to do when they get there, and how much to pay. Other barriers include access, age, social class, education, health literacy, gender, geography, homelessness, institutional racism, and transportation. The field of medicine influences society in many ways. The expansion of what in life is deemed relevant to the good practice of medicine. So the belief is that Western medicine is the only legitimate type of medicine. They also create definitions of healthy and unhealthy. And there are also influences on health policies and laws. For example, stop smoking or limit sodium intake. The retention of absolute control over certain technical procedures. For example, medical procedures and medication are available from conception to death, and physicians determine when to get them and who should get them. And this is heavily influenced by the pharmaceutical companies, even though there may often be possible conflict of interest between the physician who's prescribing and the pharmaceutical companies that are recommending. Students are socialized into their future health profession through the beliefs, language, habits, norms, rituals, garments, etc. And modern healthcare is big business and contributes heavily to the country's gross domestic product. The way in which medicine is practiced, particularly the use of advanced technology and over-prescribing of medication, continues to drive healthcare costs.